Okay, first of all, to start off with, I too was sick. That is why I also started doing what I'm doing. And it oftentimes when I'm meeting with people like yourselves, I find that a lot of us have had those health challenges ourselves. And that's oftentimes the thing that propelled us into learning more and doing something different. And so when I got sick, I found out that the thing that was making me sick was mercury. I knew nothing about mercury poisoning. The only thing I'd been taught in dental school, and Dr. Larson can corroborate this, the only thing we were taught in dental school is that mercury is completely safe to place, to have in your mouth, and if you tell a patient that it is wrong or it would be unhealthy for them to have that, you'll lose your license. There it is. That's all we learned.
And it has to be disposed of very safely.
Yeah. Even though it's okay in the mouth, you dispose of it. So there's it. There's the whole mercury lecture. You just got it right there. And there's this crazy guy named Hal Huggins that lived in Colorado, and he lost his license. So if you want to have what happened to him happen to you, then you go down that road. If you don't, then you better just stay away from it. That's it. It's the whole talk right there. So it's what I knew. Not a lot. So, if the pen isn't working, there's others to choose from. So I learned that was not true, that was not even close to true or all the story about mercury. And so I'm not actually going to talk about mercury today, but that started my journey into finding out what in dentistry could be causing health problems in myself, in my patients, in all of your patients, what could be contributing to disease. So it has sent me on a very, very interesting journey. And this last piece has actually really come to the forefront even in research lately. And so that's why I want to share this piece with you, talking about how oral infection relates to chronic disease. I will talk about it in a minute, but there's this brand new book. Actually, it was just released in 2017 called The Hidden Epidemic. It's written by Thomas Levy, who is an MD, JD, which as you read it, you can tell he's a lawyer because that's the way he talks. But very definitive in his things that he states. But I love it. And the caption on this is silent oral infections listen to this, cause most heart attacks and breast cancers. Not only does he state that, but he goes on to state a lot of other things in the book, which are fascinating. So I'm going to talk a lot about his research and studies today. But this connection with chronic disease is a big deal because what is the cost of chronic disease? I think that you will all agree because these are the patients you see, right? 1 in 2 adults in the U.S. has chronic disease. I think that is definitely not overstated. And 1 in 4 adults in the U.S. has 2 or more chronic diseases. So these are, chronic disease definition basically is a leading cause of death, disability, and healthcare costs. They're the things that cause everything not to work right in society or in our bodies. So those are chronic diseases. The big 4, cancer. So 2 in 5 will contract cancer. So 2 in 5 of us in this room. So who wants it? You know, I don't really want it that bad. 500,000 people will die this year from cancer, and it will cost $150 billion to treat those people. Heart disease, 1 in 5 will contract heart disease. If you are diabetic, 2 in 3 will contract heart disease. 600,000 will die from it this year, and it will cost $555 billion to treat it. Diabetes, 1 in 10 people will contract it. It's the 7th leading cause of death, $245 billion to treat diabetes. Dementia and Alzheimer's is the 6th leading cause of death, and it will cost $259 million to treat. So chronic diseases are very costly, not only in money, but obviously in loss of quality of life. It's huge, right? And it's the patients we see. So what is the modern medicine, the allopathic model for it? This is, I love, the pharmaceutical alleviation of disease-associated symptoms, right? The Prozac and opioid deficiencies that we're all dealing with right now. Basically, modern medicine treats it by giving a drug to treat the symptom, whereas traditional medicine finds and treats the root cause. Now, I have an interesting story about this. A teacher from a course I was teaching told a story about a friend of his that was emceeing a health event. And there were 2 main speakers, and so he was introducing the speakers. The first one was going to be this MD, and he was going to speak on this, and he said, so, you know, Dr. So-and-so is going to be speaking about this, and then we're going to have an alternative care provider, an Ayurvedic physician, that's going to be speaking about some Ayurvedic medicine. So the MD got up and spoke and gave his whole thing, and then the Ayurvedic practitioner got up and he said, I want you to know that what he taught has been around for 100, maybe 200 years. What I'm going to teach you has been around for thousands of years. He is the alternative care provider. I practice traditional medicine. I love that story. So what we do is traditional medicine because it's what's been around for thousands of years, treating the root cause of disease, not finding the alternate pharmaceutical approach to take care of the symptom. So in addressing that, one etiology or root cause for a lot of chronic disease is dental infection. It is. That's the first thing we know. Second thing we know is a large number of people have dental infections. We're going to go over numbers here in just a minute. Dental infections do affect health. I can tell you that because I see it every single day, and there's research to show this. It's amazing how much research there is. And number 4, it's often asymptomatic. That's the interesting piece. It often doesn't hurt. So, like I said, Hidden Epidemic, this book, love this book. His quote from the book that I really keyed in on is that nothing else comes close to having as large of a negative health impact as undiagnosed dental infections. And we're going to look at some numbers in a minute to show you why. When you're treating a patient and you have unresolved problems, you're doing all you know to do, think dental infection. Very likely that is a piece in resolving their care. How do dental infections impact health? So there have been thousands of research articles connecting dental health and overall health. Everything on this side of the list is listed plus, is added to or is affected by dental health. There's so many things that are affected by dental health, but these are some of the things. The reason that he wrote this on the front of this book is because 78% when someone had a heart attack, when they strip the vessel and take the clot out, 78% of those clots had oral pathogens, oral specific pathogens. That means 78% of heart attacks had a causative agent coming from the mouth. 1 or more root canals in your mouth, more heart disease. It's very well proven in research. There's no debate about that. That's not an opinion, that's proven. Cancer, you have a 2.5 times increased chance of getting cancer if you have a root canal tooth. There's a doctor in Switzerland. I'm actually going to Switzerland in June. I was just telling a patient today, it's like the Mecca for me. It's like my Mecca. I'm going to Switzerland, and I'm going to meet Muhammad. And he wears white pants in his clinic. Really interesting man. But I can't wait. I told all these ladies they have to wear white pants when we get back. Because we're going to be a Swiss when we get done. And they're rebelling about that. But he has been treating these diseases and has found that when people have breast cancer, 95% of those patients have a root canal, the majority of them right here in the upper bicuspid area. It is so causative, it's crazy how often that happens. Okay, so now, as I was thinking about this, I thought, okay, yeah, I'm a dentist. Of course I'm going to say everything's caused by dental infection, right? When you have a hammer, everything looks like a nail. Well, I'm going to show you why that's not only the truth anymore, why everything just doesn't look like a nail because I'm a dentist. It really is true. We can see this now, we can treat it now, and we can measure it because we have cone beam CT scans. You've probably heard of this. This book written by an MD was just going on and on and on about the necessity of cone beam CT scans, and I'll show you some today, and you'll see why we need them and what we see on them that I could never see before. That is how we see it. We now know a lot better how to treat it. We can measure it with things like the CT scan post-operatively, but also things like blood tests with C-reactive protein and things to test for inflammation and often just symptom alleviation. Symptoms go away. You're treating it. Lack of symptoms does not equal lack of disease, and often in dental infection that's the case, and we'll talk about why often this doesn't hurt. Disease is present, but we've been missing it for years. It's there, but we just haven't been able to see it. We just didn't know it was there. So do the math. Okay, so at least 35% of the population has at least one root canal in their head. Of the people I see, I'd say it's probably close to like 99%. Wouldn't you say, ladies? You're the ones who are taking the x-rays every day. I mean, how often do we see a patient that doesn't have at least one root canal? I mean, I don't know that we see one a week even. It's very uncommon anymore. So at least 35% have at least one root canal. That equates to 50 to 20 million root canals performed in the U.S. per year. 95% of those root canals have infection. So how many people does dental infection impact? 35% at least of the population has most likely a dental infection. What other disease-causing entity can you say that about? Affects 35% of the population. That's huge. That's huge. I think it's higher than that. And for the population of people that we see, I think it's much higher than that because we see the sick people. So we see everybody who has this. We see the whole 35% are the ones that are already seeing us. The infection causes and worsens cancer, heart disease, dementia, and many, many, many other things. Again, coming from the book, this is a modern plague worse than any pandemic ever seen. And the cool part about this, and actually I was going through this a little earlier and I got teary-eyed reading that little phrase right there. We can reverse disease that we never thought was reversible. Because dental disease is fixable. Like I can take a tooth out and it's gone. I can remove a cavitation, clean out a cavitation, and it's gone. Some other disease entities are a lot harder to get rid of. This one, we can get rid of it. We can get rid of it and it's gone. So it's really exciting. Okay, two of the primary ones that I see are chronic apical periodontitis. Basically, that's an abscess tooth. It can either be from a dead nerve in a tooth causing an abscess or a root canal that has failed and still is infected at the end. That's number one that we see. The second one is bony cavitations. I'm going to explain both of those a little bit more in detail. So a root canal, why does it fail? So you can see on the far left picture, that's a picture of a root canal, or at least the nerve area inside of a root. You can see there's one main nerve with sometimes some lateral channels that go off of that main nerve. Well, what you can't really see, I tried to get a picture that shows it, but this doesn't show it real well, is there is literally a mile of tubules inside of every tooth, literally. So each of those tubules has tissue inside. So when we do a root canal, we clean the main canal, but there is no way to clean all those tubules. It's impossible. So there is tissue still left in that tooth after a root canal treatment. We'll talk in just a minute about why that's a big deal, but there is still tissue there. So that's part of why the issue happens with root canal teeth. Cavitations. Now, who of you actually have heard of a cavitation before? Most of you in this world, you probably have heard of it some. Let me tell you how it happens. So when a tooth is removed, each tooth has a ligament around it, surrounding it. It's called a periodontal ligament. If that ligament is not removed with the tooth, and it doesn't just come out with the tooth. It's kind of like, you think of like an egg, you know, the shell, sometimes that little scummy thing comes off when you peel a boiled egg, sometimes it doesn't. It's the same kind of thing with the ligament, but most of the time it doesn't come out with the tooth. When the ligament is there, it's the way that the tooth is nourished. So if the ligament stays, the body thinks that there's still a tooth there. It caps off the hole, you can see in the middle picture there, it caps off the hole where the tooth came out of, but it doesn't fill it in. What ends up happening is that whole cavitation area fills in with soft tissue, which there's no place in the body that has nothing in it. All kinds of anaerobic bacteria start to inhabit that place. We have found fungus, virus, parasite, bacteria like crazy in these cavitation areas. Now, do we see these? Oh yeah, every single day of our lives. We're going to show you some photos here, or some x-rays in a minute. Root canals, like I said, they're a problem because you can't clean them completely. Now, the blood supply's gone. That main nerve area that was filled in, that's where the venous tissue was as well, the circulatory system inside of that tooth. So we've cleaned that out, plugged it up, so now immune cells can get into the side of the tooth. So if there's bacterial cells, there's nothing to fight them in there anymore. You lose the warning system, the nerve's gone, can't feel it. Endotoxins as well. So not only are there bacteria, but there's toxins from the bacteria because they're anaerobes, they're the bad dudes. Every time you chew, it pushes those toxins throughout the vascular system, throughout the lymphatic system with every bite. Pump, pump, pump throughout your system. So it's a big deal. Okay, so does every root canal tooth need to be removed? Like everyone in the whole world. So this boy got hit in the mouth with a baseball. He broke his two front teeth halfway down. My finger isn't very fine-tuned on this, but right in this area, both of those front teeth got broken halfway down. One of them we were able to save with the root canal, the other one we were not. He was also congenitally missing, just was born without the tooth next to it. So now he's going to be missing his three front teeth. This boy has a root canal, and he's still going to have a root canal. And I know this because that's my 18-year-old son that's on a mission in Peru right now. And he still has that root canal in his head right now because it's holding three of his front teeth in. He was going to have a real hard time talking to people missing his three front teeth. So he has that, and that's how we approach root canals with people a lot of times is it's a placeholder. It's a placeholder. It's a way for you to be able to get in a different place where you can, deal with losing a tooth mentally, financially, physically, health-wise, whatever it is. Is it a long-term solution? No. I never see a root canal as a long-term solution ever. But sometimes it's a temporary solution. And a lot of times the clinical impact is dependent on the health of the person. So those four other ladies below, we're going to show x-rays today of. And you'll see that all of those people have health implications from the root canals that they had. But I do want you to think this. If someone has chronic degenerative disease already, then you need to think dental. So somebody like my 18-year-old son who's healthy, 18 years old, does it ever get better than that, right? Never. So, he's the perfect person to keep that root canal for now, for a little while, for a few more years until I can do some implants on him. But if you already have chronic degenerative disease, you don't leave it alone. You don't leave it alone. Cavitations are a problem because how many people get wisdom teeth removed? Almost all of them, yeah. I would say probably 90%. So 90% of the people have at least 4 extraction sites. 88% of those extraction sites have cavitations. And if you had a dry socket at all, 100%, it will have a cavitation. So cavitations are a huge piece of inflammation. If you have somebody that has chronic inflammation, inflammatory conditions, all autoimmune, right, is inflammatory, good possibility that there's a cavitation that's contributing or causing that inflammation. Okay, so let's look at some x-rays. So top x-ray over here on the side. So symptoms, sorry, it's a little hard to read. Fatigue, cancer in remission, overall ill health. She just feels lousy. So let me start to orient you a little bit. Left, right, you can see the 2 circles are sinuses. We're seeing a 2D version of a 3D x-ray, so I'm able to manipulate this and see a lot more on this than what we're going to see now, but I couldn't really put that up here on this screen. So what I want you to see is right here is an abscess tooth. Can you see that above the end of that root? See that half moon shape? That's an abscess tooth. So now can you spot another one? Right next to it. Number 2. See another one?
Yep. Several.
Right?
You're
This right?
Yep.
There's a huge one right there. This one right here, interestingly enough, has what we call internal resorption. Look at the inside of that tooth right there. Basically, that whole tooth was dissolving from the inside out. Yeah, she has multiple abscess teeth. Not only that, but this is what bony cavitations look like in the wisdom teeth area. That whole area is empty right there. Empty. Should be full of bone. So the other side, is it a cavitation? Uh-huh. Right there too. She had, I don't remember, Margot, 1, 2, 3, 4, 5 failed root canals, I believe, because the bottom one is, I just had to take it out of focus. I think she has 5 failed root canals and 4 cavitations. She feels pretty crappy. There's a reason. Okay, next one down. Headaches, lump on her left breast and lump on her back. All right, so do you see anything on the left side that may be infected? How about right there? Do you see it on the side of that root? It's huge. That half circle sticking out right there. Huge abscess on that tooth. That's the left side, left bicuspid. That is almost 100% correlative with left breast cancer. Almost 100%. She also had an abscess on this tooth and huge bony cavitation right here. Bony cavitation here. She had a retained root tip. They missed a root tip on that side when they took out the wisdom tooth, and it has a cavitation infection around it. So this is daily. This is what we see every day of our lives. Okay, let's see some more. Okay, next one. Extreme anxiety and depression, hard time breathing and sleeping, tremors, adrenal fatigue. She is, maybe mid-40s, maybe. She just went on a trip to Crete, had a fabulous vacation, came back, crashed. Literally has not been able to survive life since she got back. Any abscesses on her that you can see? There's a big one here, really visible right there. You see that one above that root?
On the other side too.
On the other side as well. This one here is, this one is, this one is, this one is, this one is, this is bony cavitation, bony cavitation. Once we started showing her this, she said, I want them all out of my mouth. So she's getting them all out sequentially. We're doing it, in a smart way so she can actually chew. But she wants them all gone because there was frank abscesses on, I think it was like 6 out of 9. The other 3, I kind of went, well, they could probably stay for a little while. She said, I want them gone now. Next one down, no health symptoms. None reported. Isn't that interesting? But look at this. This Look at the sinus infection she has right there. See that? The root canal right below it, badly infected, draining into the sinus. That's why it doesn't hurt. It drains up there. Every single one of these root canals is abscessed. Every single one. The interesting part about her is she's coming from the endodontist, the root canal specialist, was going to retreat all of those. I called him and I said, he's a good friend of mine. I said, help me understand this. She has 1, 2, 3, 4, 5, 6 root canals, and every single one of them has failed. You diagnosed them as failing, but you're going to redo them. I said, well, what means you're going to have better success this time? They're not going to fail again this time. And he said, oh, all of them aren't done well. There's reasons that all of them would fail. And I just said, but why do this again when it's going to fail again? And so we presented this to her, and she said, oh, well, let's get them all out of there. We're going to get them all out of there. So she doesn't even have health symptoms that she knows about. Oftentimes what I find with people like this is they go, oh my gosh, I had no idea how I was adapting to my life. I didn't have to sleep on an incline anymore. These things that you just do to adapt, she didn't have to do it anymore. Okay, why are we finding this so much? Because I couldn't see it. The x-ray on the left is the periapical x-ray that I have used for 20 plus years. That is the same person. I want you to see on this cone beam scan, and this is a little bit of a scattered one, but right here, can you see the amount of bone that's destroyed around those 2 teeth? That's those 2 teeth right there, are right there. On this x-ray, I could see nothing. Nothing wrong. That looks perfect. Those 2 root canals right there are perfect. There's nothing I would do to take care of those, but why does it hurt? It's hurt for a really long time. Hurt, she did have symptoms. Why does it hurt? I don't know. Let's take a CT. Oh my goodness, maybe it hurts because all of the bone over both of those roots is completely destroyed. Maybe that's why it hurts. We couldn't see it. Could not see it. Had no idea it was happening. No idea until we got these CT scans. Okay, what's in there? So we biopsy some of these. When people really, really want to know what's in there, a lot of times we just say it's just really bad things. And they're fine with that. Because honestly, we're not going to really change treatment based on what it is because we're hoping that we're going to alleviate it. But we found all kinds of crazy stuff. These are about medium-sized ones. Usually I find about, a third to a half more of microbes coming out of these areas. Some of these are ones that say, oh, this is normal for mouth. Some of these are not normal for anybody. These cause chronic disease. That's what we're finding inside of them. So last point is just what do we do with it? This is a really important point as well. Not only do we need to identify them and be able to explain to people what's going on, but we need to treat them right. So the first thing is they have to be removed correctly. All the horror stories coming out of dental offices are from tooth extractions, right? He had a knee in my chest. I've yet to meet the dentist who ever put a knee in somebody's chest, but everybody's met him. I swear, everybody's met that dentist. And so gentle removal is very, very important. Today, I was actually I always tell people, it's going to be really boring. I'm sorry. It's just a matter of patience. And I was just rocking this back and forth, back and forth. I actually had to stop and do this for a minute. You know why. He's the one that treats me for this problem. And the patient started laughing. He goes, are you going to make it? I said, oh, no, I always win. I always win. And so then you put your hand back on and you back and forth and then just very gently, there it comes. That's important because the bone that's saved when we do it gently is the bone that's used to be able to restore things in the future. So that's very, very important. Then we have to clean them correctly. These are 3 pieces that are absolutely essential in my cleaning regimen. So ozone, we treat with ozone gas and ozonated saline. Ozone is a universal antimicrobial, basically. It's going to kill everything in sight. So we treat it with that. We treat it with laser energy, a couple different ways actually that we use the laser, but it's called an erbium YAG laser, and it creates micro bubbling, and so it literally bubbles everything out. It's amazing to just watch it, just see this gunk just flowing out of the socket. It's really cool. And then we use a couple other things as well, sodium bicarbonate to help alkalize the area so that the pain is diminished. And anyway, a few different things to help clean it correctly, and that's a process. That takes a little while. And then replace it correctly. So we use what's called PRF, platelet-rich fibrin. What it is we do a blood draw. All my assistants love to draw blood now. It's really fun. We draw blood, and we centrifuge it out and pull the fibrin out of that. And those little slugs that look like big snots, those are the PRF. And that's what they look like, that we pull them out of the tubes, the blood draw tubes. and flatten them out. We squish them out, and they become flat snots or flat slugs. And then we cut them into pieces, and those pieces are like pancakes that we stack inside of the area where we take a tooth out. What that does is it prevents any cavitation because the bone now has a framework or scaffolding to grow to. So there's never a cavitation. And not only does it have a scaffolding, but it has a scaffolding that's from that person. Because any kind of synthetic or cadaver bone grafting material caused a reaction in patients. This doesn't, because it's their own stuff. So it creates a scaffolding for the bone to grow to, so we no longer have bony cavitations. Then the last piece is the way that we replace the tooth. So we used to always replace them with titanium implants, and I have a titanium implant myself because it was put in there 20 years ago. Titanium implants are still working today, but some people have problems with the metal. And what we're finding is late failures with titanium implants. So I don't see these fail today or tomorrow or next year. I see them fail 5 years from now, 10 years from now. Because the body slowly scavenges around here, scavenges the little pieces of titanium and zinc and nickel. That is an impurity in this, and you all probably know about nickel impurities. So nickel impurities that are in this, the body slowly scavenges them and it destroys the bone that holds the implant in, and the implant fails. So we're now placing zirconia implants. They're completely ceramic, and what we're seeing is, and Mecca, Switzerland, Mecca only does these as well, but they don't have the same response. The body just accepts these as a tooth, and then we put a tooth on top, and it's like you never lost a tooth. So there are ways, and there are proper ways to restore them. Or you just leave it alone. Don't put anything back in there. You know, teeth aren't necessary for life. You can actually live without them. You might not want to, but you can. So that's the way we replace them. So that's it as far as my presentation goes. Hopefully that gave you a real fire hose of what we do and what we see every single day, because it's every single day that we see this. And it's just fascinating. And so we're thrilled to be able to now find these things and treat them to be able to help people regain their health. So that's what we do. Thank you.